What we're doing today is a breast reduction with a breast lift. So pretty much we're going to reduce the volume of the breast and also achieve a lift. The procedure takes 1 to 2 hours. We've achieved our objectives 1 hour later. We now have a breast lift and we've excised 1 kg on each side. The procedure we're doing today is G-spot augmentation and vaginoplasty. This is where we make the G-spot more prominent and more sensitive, and it's part of the cosmetic gynecology services at Tribune Medical Group. Start off by marking the areas where we are going to liposuck. Remove this area around the belly fat, create definition along the costal margin, then get rid of the lavenders on the side. Okay. If you can turn around, so on the back again, we want to kind of define where your waist is. It means that we're liposucking this. They're creating, you already said just by doing this, you have created a definition between the waist and the hips. Then we start adding from this way, going down. Then we create our diamond here. Get rid of the lavenders. So this is how we've done our BBL. As you can see, we've reduced the waist. We've created a more sculpted waist, and you can see the transition from the waist going to the hips and the elevation in the butt, creating that butt lift. This is a BBL. So today we're doing a gynaecomastia reduction. Gynaecomastia pretty much is enlarged breast in males. So this is like a 15-year-old boy. The technique we're going to use is secondary areolar excision, where we excise the skin, get in and do a dissection, then lift the nipple to make it in a more anatomical position. So yeah, this is a condition which can be fixed. You can come through and we assist you.
Allow us to get right into it. Dr. Spanton, welcome. This is your home.
Thank you. Thanks for hosting me.
Yes, sure. So kindly just guide us. Who is Dr. Evans Spanton?
So I'm a plastic reconstructive and aesthetic surgeon.
Yes.
Currently, I'm also the CEO of Tribune Medical Group, which is based in Westlands, Nairobi.
Sure.
Yeah.
Okay. Just walk us through what it takes for somebody to get to that such kind of a desired levels.
Okay, so you first do your medical degree, which
Yes.
is like 5 to 6 years, depending on when you train.
Yes.
Then after that, you do internship.
Yes.
Then after that, you do 5 years of specialization.
Yes.
In this case, I chose to do plastic surgery. Then after the 5 years, you do another 2 years of working under supervision.
Okay.
Then you now get your operating license where you can practice independently.
Okay.
Yeah.
So you went through all that thorough process to
Yes,
the extent
yes,
that, yes. So is there any point now you come to the Kenya Poisons Board? Is it that you are looking for the license now through the, or how does it work in that?
So if you train from outside Kenya, then you have to come and have your qualifications evaluated by the Kenya Medical Practitioners Council.
Yes.
But I trained at the University of Nairobi, so I didn't have to go through that process.
Okay. Also, this is actually a preserve of those people who does the degrees or academic qualifications from outside the country.
Yes, exactly.
Okay.
Exactly.
So all our doctors from the University of Nairobi don't go through that thorough process.
They do not have to, because I'm sure, you know, the board also supervises the training that happens, so they know the training that happens locally. If you're coming from outside, however, because they don't have control of what happens outside Kenya, they have to make you go through that process.
Okay. But why is it that we are seeing the lawyers have to go to the Kenya School of Law?
Well,
why is it so?
I guess it's their own training pathway, which is a bit different from what we do. Yeah,
because after doing the degree, you have to go through another diploma again, which is also another thorough process. I think I'm told that there is where the training now begins.
Yeah, sorry, but I guess they chose to do it that way. In medicine, it's a bit different.
Okay.
Yeah.
I used to think that Poisons Board is a rite of passage, and each and every medical practitioner has to pass through that.
There is no way you regulate. Say I operate on you.
Yes.
And maybe you're not happy with the outcome, or we have a kind of disagreement or something like that. All doctors are now managed under that board. So if you have a client has a problem, they can go to the board that can be now the arbitrator
Oh, so they're kind of a mechanism for settling disputes.
Yeah. And also just oversight of the practice.
Okay.
So like if I'm a plastic surgeon, I can't come and remove your tooth. Otherwise, because I'm not trained. So they also lay out what each practitioner is allowed to do.
But I thought that a medical doctor, the general medical doctor, can do everything.
Not really.
That's what the public thinks, though.
No. People have their lanes. So my practice will be limited to plastic and reconstructive surgery. Neurosurgeon will be limited to the brain and the head. I can be opening someone's head. The board would say, no, but you were not trained to do that.
You're not qualified for that.
You're not qualified. You're a doctor, but
your limits, those are not your limits.
Yes, exactly. That's how it works.
Okay, so now we just want you to walk us through the journey of plastic surgery in Kenya and where it also merges with beauty. Okay,
so now the whole field of plastic surgery is quite advanced in Kenya, and I think it was one of the first African countries to set up a master's program for the discipline. So currently we have more than 50 plastic surgeons who are operating in Kenya. I think maybe 40 of them were locally trained.
Okay.
So in general, plastic surgery comes from the Greek word plastikos, which means to mold.
Yes.
So it's pretty much like molding, like how you mold clay.
Yeah.
So in that molding, you can either mold someone who's gotten involved in an accident. That's the reconstructive part. Like you lose your ear in an accident, you can make a new one. Yes. Or you can mold now the cosmetic part. That's where we now do the beauties, like people who want the BBLs, the liposuction, the boob jobs. That's the other aspect of plastic surgery.
So now for this, some of them look like so cosmetic. Like now, whatever you are saying, the BBL now.
Yes.
Now, walk us through what that BBL look like.
So what you do...
also the risk, etc.
You do liposuction, right? You suck out the fat from the trunk, like if it was made to be from my stomach, my sides, my back, so that you make the waist more defined. Then you take that fat, you process it, then you add it to the places where you need it to be. In the case of a BBL, you are adding it to the hips and the bums so that you know.
So you're curvy now, eh?
Yes. Yeah. So it's quite a popular cosmetic procedure in Kenya,
So as in when you're putting that, when I'm removing fat from here and I'm putting down, that fat just relates well with that part of the body.
Because
it is my fat.
So your body can't reject your own part. It's part of you. So it goes and becomes attached to another place. So just simply shifting it from one place to the other.
So how many weeks do you need without sitting down?
3 weeks.
3 weeks without sitting down? You are sleeping or not?
Just kind of like sleep on your stomach and stuff,
So these ladies really sacrifice a lot to have those things.
I think, if you really want it, I think...
First of all,
because it lasts a lifetime. So 3 weeks, if you look at it, is not that much of a sacrifice, because you have it until you die.
And what about that fat that you've removed from point A? Can it still grow back?
Yes, if you do not maintain a healthy lifestyle, it will come back. So
then you appear now shapeless. Now they really
in addition to doing the surgery, we now also give people advice on healthy living. Where the nutritionist on board will tell you about how to stay in a calorie deficit, how to work out, and at least do 10,000 steps a day so that you can maintain that new body shape.
So does it mean that if you don't go by that, then now you risk?
It's not really, how I put it to you. Any human being who doesn't work out is at a risk of obesity. Right? If you take in more calories than you are burning, then you grow fat. So what we're just saying to these people is, now we've helped you to get rid of the fat. To maintain this new body, just adopt a healthy lifestyle.
And what about if you overwork the same way our president has overworked? In the event that you overwork, now this BBL that I did and my butts are now I've overworked and it's gone.
It won't so the thing that happens with fat, if you burn fat, everything, you don't grow fat in one place, you get everything increases.
Yes.
So if your stomach is increases, your hips are also increasing.
Yes.
Your bums are also increasing. Same as when you lose.
No,
Your bums also
no. My question is, now I have overworked and now I don't have it anymore. And there come a very good day and I'm having my nyamajomas and cholesterol are back. They can't get back. I have to go through another BBL to remove them from elsewhere to get them.
The thing is, they'll always be there. If your waist is smaller than your bums, even when you increase, your bums are increasing faster because the fat there is also accumulating. You get?
I'm asking this. I'm now growing thin.
Yep, thin.
Yes, for some reason well known to me. There might be stress.
Yes, even as you grow thin,
yes,
the proportion
is the same.
They do not really change.
Yes, so the proportion is the same.
Yes.
Now it happens that the other way around now happens that after I've grown thin, now maybe I'm now increasing in weight again.
Yep.
So the fat will come back there. The same place.
Yes.
So you also adjusting the genes. So now the body reacts.
Not really. So we've transported one organ from one place to the other. In this case, from the stomach to the hips, say for instance. So if it's increasing, everything is increasing. If it's reducing, everything is reducing. Yes. In the same proportions.
Okay, so even if it reduces, then increases, you see the same thing?
Yes.
Okay, so you are advising these people that it is safe.
Yeah, exactly.
Okay, so plastic surgery also include a scenario where, like now, let's say the Mary Claire acid case.
Yes. That is a case that will be managed by plastic surgeons. It's a form of bands.
So like you yourself, you can be able to address that?
Yes, exactly.
Okay.
In the acute phase, you are trying to kind of limit the damage that the acid is causing. Then after assessing the damage, you see if there's need to replace the skin. Because it sometimes need to take a skin graft from one part of the body to replace the skin that has been damaged. Yeah.
But as in from a doctor point of view, why is it that people use acid? Is it that acid has certain effect that permanently damages somebody's skin?
Yeah, it's very unfortunate. It's a part of chemical burns. So there are many things that can burn the skin. Acid, alkalis, some caustic substances. It's unfortunate that one human being would decide to use it on another for whatever reason.
Yeah.
I think people should settle their differences in peaceful ways.
Yes,
it's very common in these Indian countries and stuff. In Africa, not so much. So even I was a bit surprised, like, why is this happening?
This kind of thing is common in some other part of the world.
Yeah, like in India, it's quite common.
Okay.
Yeah.
You disagree with somebody and they check the laws down.
And it's usually violence towards women when they now use acid in these acid attacks. More like if you think you are so pretty and I can't have you, then let me destroy your beauty.
So does nobody else have you?
Yeah, which is a very vile way of thinking. It's not right. Yeah.
Okay. So what I'm asking is, does this acid have a certain component? Yes. Why is it that...
So acid breaks down cells in a process called necrosis. So it breaks down you throw it on your skin, it produces a reaction which produces heat and breaks down the skin. Yes.
Okay. So that gives a result to a permanent damage. Or
yes, exactly.
Some
depending now on the strength of the acid. How concentrated is it? What has been the duration of exposure? So generally speaking, our advice would be if there's an acid attack, immediately try and dilute it with water. Pour water onto the plate so that you wash it away and you reduce the duration of exposure.
Okay.
Yeah.
Okay. Like now, let's say, for example, like in this case that we are facing with Mary Claire and Elvis case, from the pictures you've seen, how much will it cost to restore the guy?
It's difficult to tell. I think I only saw the initial pictures because now you'd have to wait for a couple of days. Then you see the extent of damage. You see, when we classify burns, they can be superficial, partial thickness, or deep. If they are superficial, you see how when someone pours like hot water on you, you can get a scalding, just dress it. After a couple of days, the skin comes back.
Yes.
That is a superficial burn. If that is the case, it's just since dressing and the skin comes back.
So with time, if at all that's the kind of burn that she's experiencing.
In a week or two, then, the skin is back. Okay. But if it's a deep burn now, the skin can't regenerate. So you have to take the skin from somewhere, a process called the skin graft.
Okay.
Then you take the skin either from the thighs, the arms, the stomach, so that you can replace it on the face.
Okay.
Yeah.
Also, when you do that now, the body recognizes that new skin and it's
your own skin. The same concept that we do with fat. The skin now you're just moving it from one place to the other.
Okay. So now, able to walk us through what you make of the religious groups that would find BBL to be somehow.
I think, man, religion and stuff. Yeah, I'm a Christian. I believe that people believe different things, and it's difficult to impose your beliefs on other people. You know what I mean? So even those people who might say, "Oh, we find this immoral," or this is not godly, but who are you? Like, as God told you, you know, these are someone who's making a decision about their own body.
Yes.
Not their motivation is not even to be attractive to the next person. It's to be comfortable
just with themselves.
With who they are.
Yeah.
You know, who should then come and say, okay, I think God doesn't like this. I mean, like, who has ever really spoken to God directly? I think people just want to use this as a form of control to control other human beings, which I do not agree with.
Okay, so those religious groups and even other groups that seem to try to impose their beliefs on people, you tell them, stop it.
I can't really say I have to express my opinion. I think they should just teaching the word. Like as it is, then leave it up to every human being to interpret. Because it's a personal relationship with Jesus, with God, with Muhammad, with Allah, whatever. So just preach like this is what the word is saying. Then allow people to make their own decisions. Because the next thing they're going to be telling you, like, you can't wear skinny jeans, you can't can't wear this, you can't wear muscle tops. I mean, come on, each to their own.
You become a temptation to everyone. So. I just want you to walk me through one of the botched kind of experiences you've ever had.
So there's this trend where now instead, because you know, like in when it's done by both certified surgeons, this is quite an expensive. These are quite expensive procedures. But you get now in salons people who are like, okay, you know what I can do for you at 1/10 of the price. I can just inject.
I know somewhere cheaper.
Yes. So people go there, then they get injected.
Funny things.
Whatever things that are injected. And you see, because it's not your own tissues, the body rejects it. So some people, like we had a case where a client came now, they have what is called fibrosis and ulcers on the bum. They can't even sit because now they've been injected with things which we do not know what was injected. So now we have to even cut, remove whatever is there. By the end of the process, this person is deformed. Where they had gone looking to have a nice they now have scars and arms and bumps, which, you know, cheap things and being expensive.
So as in at that particular point, the person is now fighting for their lives.
Exactly.
Now, not the beauty anymore.
And now they can't, because this is not a person registered under anybody. If they switch off their phone, you can't ever find them again. Because at that time, the more we have a problem, they can't be found. Then now eventually they're like, hey, let me go to the hospital.
Now proper hospital to get this fixed.
When you ask them what was injected, even the patient doesn't know what was injected because they were not told. So it's just like, okay, let's just remove everything and now see if we can reconstruct this so that you kind of have a semblance of a normal life.
But life never gets normal from there.
It will be difficult because you say you're a bit disfigured now, you have scar tissue, you can't really sit for prolonged hours. So it will be difficult.
Okay. So do you find like some of those patients now begin to suffer mental wellness and confidence issues?
I definitely think it will have an impact on your mental health. Because now I'm sure you're not even comfortable to remove your clothes, to go swimming, to do those basic things.
Do also men participate in these things?
Oh yeah, for men mostly it's men with men boobs. You know, like it's called gynaecomastia.
What are you talking about? Have you seen some men boobs?
So that's a very common condition. So they come and we either do liposuction or do breast reduction surgery. Men have also been coming for things like liposuction, tummy tucks.
What are those? What are those?
You know, if your tummy is too big, you know, some people have a tummy that is so big.
Oh, okay. Not like mine here.
Good. Maybe like 3 times mine. You know, they can't even tuck in their shirt because the tummy is now way there.
Okay.
So those that get like tummy tucks, liposuction. Then the guys who are getting a bit old come for facelifts, those kind of things, blepharoplasties, just so that they can maintain a more youthful look.
So some men also want to appear more young.
I think
I didn't know that men also suffer some of those things. We thought that men, the way you are is the way you appear.
I don't think anyone wants to really look old and, you know, like worn out. If you can keep the face that you have now for 20, 30 years.
So right now I can look like a 17-year-old if I consult with you.
So now the thing that we now advocate for is called pro-aging, right? We start these things like exosomes, Botox when you're at this age.
Yes.
And collagen, taking care of your skin so that you reduce the effects of aging. So if you start taking care of your skin now, in 20 years, and we compare you to a colleague who hasn't been doing the same, you'll be looking maybe like 10 years younger than them because we've invested in the care. Maybe you can advise us on maybe what are those that we are supposed to... There are things now called like exosomes, polynucleotides, collagens that help with skin regeneration.
So that's a skincare routine?
Kind of. But they are offered now in like medical aesthetics clinics.
If I found my son wearing those things, I think I'll be having a problem with that man.
Not really saying. Okay, have you ever wondered why, say, people like Brad Pitt and stuff, the way or even Will Smith, the way they used to look when we were kids,
they still look the same.
Exactly.
Yeah.
It's because that technology, they had it way before us, but now we have plastic surgery in Africa. Like maybe Will Smith, if you look at his age, is the age of, and you take someone who's in Chago, you'll be surprised.
The same age.
The same age. This other guy has wrinkles, has white hair, has what? The neck is falling, but him, he still looks like a boy because of those things.
Okay, so men should be advised to, but is this that expensive?
Both men and women.
Is this that expensive that maybe people from this part of the world might not be able to afford?
Invest a bit of money. It's not cheap.
When you're saying a bit of money, what are you talking about?
Okay, we're looking. I can give you ranges. Obviously, I can't go through all the procedures, but most of the procedures I would say are between 450K and 650K.
You're talking about Kenya shillings or Ugandan shillings? Tanzania?
Kenya shillings.
Yeah.
That's not a lot.
So if me as a young man, as an old man that I am right now, should I come to consult to look 15 years younger? It is possible with 450,000.
No, okay.
Or I wait until I'm old.
Yeah, when you're a bit old and want to restore you to this place, when you have wrinkles, when your face has drooped, that's
what about if I just want to maintain it this way?
Yes, now that's the thing. Now for maintenance, it's not as expensive. For maintenance, you can have a routine, maybe like 20, 30K per month. You get those things.
Come on, that's somebody. That's somebody's salary.
But you know, it's a long-term investment. It's a long. Say
so per month for all?
For forever. Like you maintain your looks. You try to maintain your looks.
Okay, so that's the reason why we see these politicians. Some of them don't age.
That's the thing.
Because they can afford.
They can afford it. You can imagine going in front of people, asking them to vote for you, but you're looking like maybe you die tomorrow. So you have to kind of be young looking.
Okay, so you are saying that the religious community have just stigmatized something that is good for the society.
Because they should. You said, like how I explained, this same plastic surgery is the same that helps kids who have cleft lip, who are born with defects, to restore them. Yeah, it's the same that absolutely helps accident victims. You have your nerves cut off.
Yeah,
you can't use
it's
your
the same
hand
thing.
with it. So it's the same thing. So if someone is looking a certain way and they feel they want to look a bit better, it's their choice, man.
Yeah, it is them to actually make that decision, and it ends there. Yeah. So now, I'm wondering, I have my shosh back in the village. She just looked good. She didn't look her age, and she's not using all this. So what is it that these people used to use way back then, or what kind of lifestyle is it that makes them look significantly just well off? And what is this society today getting wrong that they age so quick?
Well, I would say it's multifactorial. It's from the diet. What's the diet like? Rural people eat a lot of organic food. I think now there's more of GMOs. Then there's this thing of general stresses in life. I think now there's more pressure. There's more,
than it used to be in the past.
Yeah, you find people who are in their early 30s already they have white hair and stuff. And you're wondering, but I think it's because of the pressure of life. And also maybe like the things of smoking, drug abuse. I think in rural communities it's more controlled. In places like Nairobi, people can literally be drinking every day, and part of that urban culture and stuff.
So your system gets so tired. Okay.
And trying to also cope with the current socioeconomic space and stuff. So that's something my take on it.
So if somebody actually observes the health and temperance in terms of what they eat, how they practice and all that, they are more guaranteed to remain as youthful and
part of those things are healthy diets, regular exercise, thing as sunscreen. You can't be out in the sun every day. The sun has a direct photo-aging damage on your skin. So, you put sunscreen, protect yourself. If you wear a hat or something, those kind of things. You make a deliberate effort to take care of not just your skin, but your whole body.
Okay. So somehow you're offering solutions to some lazy people who never, some lazy people who never followed some of those protocols. Okay. So just tell us some of the good moments you've had in your profession, and probably even the bad moments that you've had.
The good ones are obviously what's it called? There's a psychological aspect to how your body looks. So someone can walk into your office, they look depressed, even they have downness in their eyes. Then you do, say, breast lifts, tummy tuck. The next time you see them, even their wardrobe has changed. Where they couldn't wear like clothes that they wanted, they are now, they are now more confident. Even their smile, their face lights up, and they're like, oh, okay, this is a good thing. They have actually made a positive difference.
Transformed somebody.
So even those ladies who have a condition called gynaecomastia, you can have someone with like breasts which literally weigh 10 kgs, right? That's like a huge load that you're carrying every day. You reduce them, you make them small, and
that cannot be natural.
It's natural, but when they overgrow, they become a burden, because you can imagine you're carrying 10 kgs on your chest every day. It makes you tired, gives you back pain. You do an operation on someone, the next time you see them, they are relieved. They're like, what? For the first time I can run, I can what? Because they haven't been able to do that their whole from teenage to adulthood. So those are great experiences that motivate me to continue doing what
also when you see somebody's life transform, you feel that this is amazing, and this is a profession you want to do from time to time. What about those bad moments?
Bad moments, man, are just like losing life. Like you said, we deal with burns as well. There's a young man, I think he was working for some steel plant, and there was an explosion where he was working. By some grace of God, he was carried and he was brought to Kenyatta, right, when I was still a resident. I think I'll put his burns as around 90-95%. He could still talk. So in those few moments that you had, you kind of know he's going to lose his life. So you ask him, like, bro, do you have a wife? Do you have kids? Like, oh, I have a wife and 2 kids. I'm like, hey, we're going to put you on this ventilator. but I don't think you're going to get out of it. So maybe before we do that, I'll give you like
some
5 minutes. You call them, so you can say goodbye. You know, it's very unfortunate.
Okay, no, that is your probability of this person coming out of that place is between 0 and none.
It's almost 0, because 90% burnt. You're literally burnt from the head to toe. Maybe the only place that is burnt was where he was wearing boxers under his overalls, like just the brain area. That's the only place which wasn't burnt. So when someone presents like that, you know, like for a fact, they're not going to make it.
Oh, okay.
Yeah. Then you see this is someone who woke up thinking it's a normal day. They expected to go home back to their wife and kids. And now you have to tell them like, well, you know what, you can use the hospital phone. Just, you know, tell your wife like, okay, bye. Tell your kids like, you know, I'm not coming home. You know, and that's the bad side of the job.
Oh, okay. At least allowing them to have that closure and
but even
talk
you
to their loved ones.
as a doctor, it makes you feel a certain type of way, like, hey,
It feels like this person is on the death row and the day has come and the one executing them. Do you feel that?
Yeah, and it's, you know, it's unexpected. This is a young person. No one wakes up expecting it's their last day on earth. So when you meet such moments, then you're like.
But is there any form of probability that they might even come out of that place?
Nah, not really. You know, with burns, when they're above like 60-70%, even in the Western world, the probability.
It doesn't matter the technology that we
because you know the damage that has been done to the body is so much that surviving that becomes almost impossible.
Yes. So you've witnessed several times whereby they take the phone and now they are calling their loved ones. And they explain.
I think this thing just stood out to me because, you know, I'm not working in the burns area every time, but it's just one that I personally interacted with. I'm sure colleagues sometimes also have the same experiences. But then again, not every burn injury is fatal. Some people, you know, when they are not as extensive, they
survive
recover.
it out. Okay. So now in this case whereby somebody is now making a phone call to their loved ones and giving their last words, as you are standing besides there, what do you do? What do you say? What do you feel?
That's the thing. That's a worst experience. That's the other experience of being a doctor and also like being a plastic surgeon. People assume it's all glitz and glamour. But on the other side, there's actually like difficult clinical situations that you're handling.
So at that point, do you, as a Christian, do you tell them to repent?
No. The other thing that
you
happens
pray
in
for
medicine,
them?
you are also not allowed to kind of impose your faith on those you are serving. If at that point it did occur to me, maybe I would have offered like because you don't know, maybe someone is Muslim and you want to give them Christian rights, they might find that offensive.
But so, if you're in your documents, you've already seen that this is a Christian.
Then you can pray.
You can ask them out to just have a word of prayer.
We do pray with some of our patients. We do offer even before surgery, like, would you like us to pray with you? If they accept, then we proceed.
But don't you think that if you told them that, would you like us to pray with you on this and you're doing a surgery, then they said no and they came and the surgery is botched. But
you see,
we'll see how that now goes again.
No, there are many religions. That's the thing. That's the thing I was telling you. I can't assume everyone is a Christian.
So unless they ask you.
No, I offer. For my I tell them like, okay, I'm a Christian. I usually pray, at least for myself before surgery. But if you don't mind, we can pray together. Not that because I'm afraid, but just, you know, so that, you know, it's a routine that I do so that God can bless the process that we're doing.
So God can come in handy. And,
but say if it's a Muslim, they have the right to decline. And I will not pressure them and I will not feel any type of way. Or if it's a Buddhist, it's like, oh, you know, I've already done my Buddhist rituals before I came here. That's them.
But probably, if at all you've already seen that this is a Muslim, do you think there is any merit now even asking them?
It's everyone. No, now you say at that point some Muslims agree to pray.
Oh, some of them.
Some of them agree. Some of them are open to that. Some Buddhists agree. Some, yeah, but some are like, I do not want, so, just seeking consent.
What about if at all you in the documents, you see that now the person that I'm operating here is an atheist?
That's their decision, and I don't, that's between them and their God.
So for that, you not want even to ask them? If at all
I can ask them. I can ask them, do you want us to pray? Because, atheism has different variations. Some people call themselves humanists. Some people feel like they can directly talk to God without any intercession from Jesus, from Muhammad, and from what.
Sure.
So it's just...
so some people just believe that there is a God. There might not just be the God that you worship, but I still believe there's a God or something like that.
At least that's my understanding.
Okay. So now as we wind up, we just want you to let us know, what is this that our population in this part of the world does not know about plastic surgery, BBL, and etc. All that combined together.
So I think there's still the trend where people are traveling to Turkey, to India, to where some even the UK to get services.
Yes.
I would just want to tell them, those services can be done locally.
Can be done locally.
Where you see if there are any complication. Number one, you're still at your home, you still have your relatives around you. So even going for post-op care is easier. And then the unfortunate event that you have a complication, your doctor is easily accessible. Now, if you go to India, you get the operation done. A week later, you are here, you have a complication. Are you going to fly back to India for a review? Doesn't sound very practical.
Sure.
So I'd just advise them to check. The training is advanced so much over the years that most, even across the board, even in non-plastic surgery, most of the things that people are traveling out for can actually be competently done in Kenya.
Okay. How spread are you guys within the country? Is that you offering this solution only here in Nairobi? Because I understand you are in Westlands. And that will be Nairobi. So if somebody is in Kisumu, somebody is in Mombasa, they have to come to Westlands.
Well, there should be other plastic surgeons in those areas, although a lot are concentrated in Nairobi. For our practice specifically, we have more of an international appeal. So we also get clients from Rwanda, Tanzania, Uganda, Ethiopia, then far down south, Zambia, Zimbabwe. So we have systems in our clinic which allow for pickup from the airport or from SGR or from wherever you land. You come, brings you to the hospital, and we have accommodation that we provide after the procedure. As we are monitoring you, then airport drops off as you go back. So pretty much anyone in Kenya can get in touch and we assist them.
Okay. So now, as just the last kind of parting shot, I would just wish you to just talk to your target audience and potential customers. Just tell them where you are and maybe the quality of the services that you promise, etc.
Okay. So we are based at Trebo Medical Group. This is situated on number 94 Mutiti Road, Westlands, here in Nairobi. Our socials are pretty much the same name, Trebo. It's on Instagram, Facebook, TikTok. You can get in touch even on our website, www.trebo.com, trebomedicalgroup.co.ke. So come, we look forward to serving you.
Absolutely, and that's a very, very comfortable point to finish it. And thank you so much, Dr. Evans Spanton. And I wish the entire group all the best in what you do to this part of the world. We are developing with our pace, but thank you as well for bearing with us. I'll keep inviting you from time to time once we have all these questions so that you can be able to help us through. So thank you so much for honoring our invitation. Feel free, and this is your home.
Cool. Thanks for hosting me, man. Much appreciated.
Okay.
All right.
So, gentlemen, members of the public, that was Dr. Evans Spanton, who offers excellence plastic surgery. Allow me to see you in the next one. Find your time and consult with him.